The vagus nerve has both motor and sensory components. It includes axons which emerge from or converge onto four nuclei of the medulla. The four nuclei include the dorsal nucleus, the nucleus ambiguus, solitary nucleus, and the spinal trigeminal nucleus. The dorsal nucleus of the vagus nerve gives rise to visceral efferent fibers for parasympathetic innervation and receives information from inferior vagal ganglion. It also provides parasympathetic motor innervation of intestines, pancreas, stomach, esophagus, trachea and bronchial smooth muscles, mucosal glands, kidneys, liver, and heart. The nucleus ambiguus gives rise to the bronchial efferent motor fibers of the vagus nerve and preganglionic parasympathetic neurons that innervate the heart. It's responsible for inhibiting heart rate. Solitary nucleus receives afferent taste information and primary afferents from visceral organs. It supports maintenance of heartbeat, blood pressure, respiration, and digestion. The spinal nucleus receives information about touch, pain, temperature of the outer ear, and posterior cranial fossa and the mucosa of the larynx. It provides innervation that triggers nausea or vomiting when the eardrum is touched by external stimuli. The vagus nerve is the largest cranial nerve, and it is known as the wandering nerve because of its large distribution. Because the vagus nerve is both sensory and motor, it has a lot of nerve endings. The general visceral efferent nerves provide parasympathetic innervation of the intestines, pancreas, stomach, esophagus, trachea, bronchial smooth muscles and muscle glands, kidneys, liver, heart, and lungs. The special visceral efferent nerves include the nucleus ambiguus, which serves the striated muscles of the larynx, and the pharyngeal and palatal muscles. General somatic afferent nerves provide information from the skin covering the eardrum and external auditory meatus. General visceral afferent provide information from the larynx, the pharynx, which are both motor and sensory, the abdominal and thoracic viscera, the bronchi, and the esophagus. And lastly, the special visceral afferent nerves provide taste sensation from the epiglottis. We consider the vagus nerve the queen bee because it is complex, important, and bossy. It can control when and how much you breathe, speak, eat, and even manipulate the conditions of your heart. In terms of speaking, swallowing, and breathing, it provides innervation of the pharynx and larynx, which are associated with swallowing, phonation, and motor function. It also provides laryngopharynx innervation, which allows the larynx to remain open during breathing. The vagus nerve plays a role in eating and digestion. It is involved in parasympathetic digestive tract regulation and controls the pharyngeal muscles, which are necessary for swallowing. It also plays a role in the contraction of both stomach muscles and intestines. This nerve also regulates heartbeat and blood pressure. It is involved in the taste sense from the epiglottis and the root of the tongue, and it innervates the skin of the external auditory canal and external ear. Damage to the pharyngeal branch can cause a deficit in swallowing, potential loss of gag, and hypernasality due to weakness of the velopharyngeal sphincter. Unilateral pharyngeal branch damage can lead to a failure to elevate the soft palate on the affected side, which results in hypernasality. A bilateral lesion results in absent or reduced movement of the soft palate, which leads to hypernasality, nasal regurgitation, dysphagia, and paralysis of pharyngeal musculature. Lesions to the superior laryngeal nerve can lead to a loss in sensation in the upper larynx, the stretch receptors, and paralysis of the cervicothyroid muscle. Recurrent laryngeal nerve damage will alter sensation below the vocal fold. Unilateral recurrent laryngeal nerve damage can result in flaccid vocal folds, which is accompanied with a hoarse and breathy voice. Bilateral lesion may cause the vocal folds to become paralyzed in a paramedian position, which will compromise the airway by risk of aspiration. It will also permit limited breathy and hoarse phonation with limited pitch range arising from loss of tensing ability of the vocalis. After describing the function of the vagus nerve and the consequences of damage to the vagus nerve, there are clear implications as to why this cranial nerve is critical to communication. Without it, an individual would suffer from locked-in syndrome, aphonia, and dysphagia, and have difficulty in swallowing, chewing, breathing, and making facial movements. They would have vocal loss and no phonation. How can one use speech to communicate when they have no ability to produce sounds? The vagus nerve makes speech possible.